Are you over 60 and dealing with vague stomach discomfort that just refuses to fade? What if those mild aches and uneasy feelings aren't simply normal aging, but early alarms of a far more serious condition, stomach cancer, quietly developing inside you? Every year, thousands of seniors face this hidden threat, often confusing early stomach cancer symptoms for harmless indigestion, heartburn, or stress-related issues. But the truth is, ignoring these subtle signals could delay diagnosis and drastically reduce treatment success. In this video, Golden Aging Health reveals 3 critical warning signs of stomach cancer that everyone over 60 needs to know. These signs may seem minor or easy to overlook, but catching them early could save your life or the life of someone you love. So if you or a loved one has been ignoring persistent stomach discomfort, unexplained weight loss, or nausea, this video could be your wake-up call. Before we start, please tap like and subscribe to Golden Aging Health. Every week, we share trusted, doctor-backed health tips tailored specifically for seniors to help you stay informed, healthy, and empowered after 60. Let's dive into the first sign that's often mistaken for a common stomach complaint. Warning sign number 1. Persistent indigestion or heartburn that just won't quit. Have you noticed a burning sensation or discomfort in your upper stomach that just won't go away? Maybe it began as a mild annoyance after meals but now feels like a constant struggle. Many seniors assume this is just part of aging or simple acid reflux, but persistent indigestion or heartburn lasting weeks or months may actually be a serious warning sign. According to the American Cancer Society, chronic indigestion is one of the earliest symptoms of stomach cancer. Cancer cells growing in the stomach lining interfere with digestion and cause ongoing discomfort. This irritation often leads to inflammation, making the stomach lining more sensitive and prone to pain. A key difference between normal heartburn and cancer-related indigestion is both the duration and severity. If you find yourself relying on antacids daily without relief, or if the burning spreads beyond your stomach to your chest or throat, it's time to pay attention. Some people also report feeling full quickly when eating or experiencing nausea alongside the burning sensation. In some cases, the pain worsens after meals or at night, disrupting sleep. Stomach cancer can develop slowly, and early symptoms may be mild, which often leads people to dismiss them. However, persistent indigestion that doesn't respond to treatment should never be taken lightly, especially if you're over 60. Consider Margaret's story. She is a 68-year-old retired teacher who had mild heartburn for months but thought it was just stress or something she ate. As time went on, the discomfort didn't improve, it got worse and started affecting her appetite. She felt full after just a few bites and occasionally experienced nausea. Finally, on the advice of a friend, she went to her doctor and underwent a series of tests. Early-stage stomach cancer was detected. Because it was caught early, Margaret was able to start treatment promptly, significantly improving her chances for recovery. So what should you do if you're facing persistent indigestion or heartburn? First, keep a symptom diary. Note when the discomfort happens, what you've eaten, and any other symptoms like nausea or unexplained weight loss. Share this with your healthcare provider. They may recommend an endoscopy or other tests to look for signs of cancer or other digestive conditions. Early diagnosis is crucial because treatment at an advanced stage is often more complicated and less effective. By paying close attention to persistent symptoms and acting quickly, you can improve your chances of catching stomach cancer early or ruling out serious problems. Don't ignore these symptoms by hoping they'll simply go away. Early detection can be life-saving. If you have experienced persistent stomach discomfort or heartburn that won't quit, write heartburn in the comments below. Sharing your experience could encourage others to seek help before it's too late. Next, let's explore the second warning signal. that may seem subtle but plays a crucial role in signaling stomach cancer early. Warning sign number 2. Unexplained weight loss and loss of appetite. Do you find your clothes getting looser without trying? Or notice that your appetite has suddenly dropped? If you're over 60, these changes could be serious warning signs of stomach cancer that should never be ignored. While losing a few pounds here and there might seem harmless, especially as we age, unintentional weight loss of 5% or more of your body weight within a few months should never be ignored. It could signal an underlying health issue, one of the most serious being stomach cancer. How does stomach cancer cause weight loss and appetite changes? As tumors grow in the stomach lining, they interfere with your digestion and absorption of nutrients. This can cause early fullness, nausea, or discomfort that makes eating less appealing. Many seniors report feeling full after just a few bites, or losing interest in food altogether, even though their body needs nourishment. A study published in the Journal of Clinical Oncology found that nearly 40% of patients diagnosed with stomach cancer experienced unexplained weight loss and decreased appetite before their diagnosis. Unfortunately, these signs are often mistaken for normal aging, depression, or other minor health issues, which delays diagnosis and treatment. Let's look at Robert's story. Robert is a 72-year-old retired engineer who began losing weight without trying. His appetite dropped so much that he was eating only small meals, and the pounds kept dropping about 15 pounds over 2 months. At first, he thought it was just stress or getting older. His family, however, grew concerned and urged him to see a doctor. After a thorough examination, including imaging and biopsies, Robert was diagnosed with early-stage stomach cancer. Because he acted when he noticed these changes, he was able to start treatment early and has a good chance of recovery. What should you do if you or someone you know is experiencing unexplained weight loss and loss of appetite? The first step is to track your weight and eating habits closely. Note any significant drops in weight and any changes in how much or what you feel like eating. Share these details with your healthcare provider, who can run tests to rule out serious conditions, including stomach cancer. Don't assume that losing weight or eating less is just a normal part of aging. It could be your body's urgent way of signaling that something is wrong. If this video gave you new insights or helped you understand how to support stroke recovery better, don't keep it to yourself. Tap like, subscribe for more trusted senior health tips, and share it with someone you care about. One simple change today could mean a stronger, healthier tomorrow. Finally, don't overlook this vital warning: changes in digestion, like frequent nausea or vomiting, especially when blood appears, can be a crucial sign of stomach cancer. Warning sign number 3. Frequent nausea or vomiting, especially with blood. What does it mean when nausea or vomiting becomes a regular part of your day, especially if you notice traces of blood or dark material? For seniors over 60, this is a serious warning sign that should never be ignored. Nausea and vomiting can happen for many reasons, from minor infections to medication side effects. But when they occur frequently and persistently, it may indicate something much more dangerous, including stomach cancer. Tumors growing inside the stomach can cause irritation or bleeding, leading to nausea and sometimes vomiting blood or material that looks like coffee grounds. According to a 2022 review in the journal Gastroenterology, blood in vomit is one of the most urgent symptoms demanding immediate medical attention. This symptom often signals internal bleeding and damage to the stomach lining, which can be caused by cancerous growths. And this is exactly what happened to Linda, 79 years old, from Arizona. She started feeling nauseous almost every day and occasionally vomited dark material. At first, she thought it was a stomach bug or side effect from medication, but when the vomiting continued and she noticed blood in what she brought up, she sought emergency care. After urgent testing, Linda was diagnosed with stomach cancer at a stage where surgery was still an option. Frequent nausea or vomiting, especially with blood, is a sign that your digestive system is struggling. Ignoring it or waiting too long to see a doctor can allow the cancer to advance, making treatment much more difficult and reducing survival chances. If you notice persistent nausea, vomiting, or any blood in your vomit, do not hesitate to get medical help immediately. Early intervention can be life-saving. It's important to track these symptoms carefully. Note how often nausea occurs, whether it's accompanied by vomiting, and if any blood or dark material is present. Share this information openly with your healthcare provider to ensure a thorough evaluation. This symptom may feel embarrassing or frightening to talk about, but remember, your doctor is there to help, and early diagnosis improves outcomes. Facing stomach discomfort that won't go away? Share your story in the comments below. Your experience might be the alert someone else needs to seek help early. Take a moment now to review the 3 crucial warning signs seniors should never ignore for early detection of stomach cancer: persistent indigestion or heartburn that won't improve, unexplained weight loss and loss of appetite, and frequent nausea or vomiting, especially if blood is present. These symptoms might seem minor or easily dismissed, but they can signal serious underlying issues that, if caught early, greatly increase treatment success and survival rates. After 60, paying close attention to these subtle signs is vital for protecting your health and independence. Studies from leading oncology and gastroenterology journals confirm that recognizing and acting on these warning signs early can make a life-saving difference. Simple awareness and timely medical consultation empower seniors to catch stomach cancer in its early stages, when treatment options are most effective. The best part? You don't need complex tests or symptoms to start paying attention. Just listening to your body and seeking help when something feels off can transform outcomes over time. If this video gave you valuable insights on stomach cancer warning signs, please tap the like button and subscribe to Golden Aging Health for more expert, science-backed advice designed especially for seniors. And share this video with someone you care about. It could help them catch stomach cancer before it's too late. To explore more about digestive health and cancer prevention, check out our playlist, Cancer in Aging Bodies, where we dive deeper into tips and strategies for healthy aging. Your journey to better health starts with knowledge starting today. Thank you for spending this time with me. I'll see you in the next video.